So thank you so much for having me. So I am really excited to um, be able to come and talk today about some non-traditional career options for folks with PhDs. I don't know, you may be here because the career options that you're familiar with are not the most exciting for you, which is how I ended up where I am. So my name is Rye Fife-Friel. I am a clinical chemistry fellow at the Mayo Clinic in Rochester, Minnesota. And so today I'm going to tell you a little bit about what options I know of for folks with a biomedical sciences PhD to get into as a career.
Rye, real quick, you're showing your presentation and presenter
Oh,
view, just so.
sorry about that.
Perfect.
Better?
Yes, thank you.
Okay, sorry about that. Okay. So let me get my laser pointer. Okay, so one of the kind of most annoying questions that I got asked frequently during my PhD is, well, what do you want to be when you grow up? And the answer was always, well, I don't know. I guess whatever you are, PI. But the truth was I didn't want to be a PI. And my program, I went to Virginia Commonwealth University in Richmond, Virginia, and my PI was wonderful. I still talk to him often, and he really only knew how to advise me into a career as a traditional academia PI, because that's what he is. And my program had us every year as part of our kind of career development, had us fill out this very lengthy survey. And I will send these slides to Brittany, and they can be provided to you all. They're full of resources, and I'll show you where to find them all. But this is actually a really helpful tool provided by the American Association for the Advancement of Science, or AAAS, called My Science IDP. You basically answer a ton of questions, both about your skill set, your career interests, and your values as a human being. And what it does is uses an algorithm to tell you what kind of careers you would be good at. And so I filled this out every year from my first year onward. And every year it would come up with these top 3 matches, traditional academia, industry research, and a combined research teaching faculty at kind of a smaller liberal arts college, which is where I went to undergrad. So I was like, I guess this is all there is for me, but I really didn't feel inspired by any of these careers. And while they were a skill set match, they were not a values match for me. And I just didn't know what to do with myself. And so something happened in 2020 that we're probably all very familiar with, the coronavirus pandemic. And I don't know what it was about the pandemic that changed my answers to this survey, but whatever it was, this is the career path matching that popped up after the pandemic had set in. And the top, I don't know if you can see the kind of rankings here, but skills match is where they rank these, but combined teaching research is now here. Industry research, I don't even see RO1 professor anymore. Might have dropped right off. But see here where my top skills match career was scientific medical testing. And I said, what is that? I've never seen that before in my life. I don't know what kind of career that is. Let me dig into it. So the cool thing about this tool is you click into it and it shows you some articles and some professional societies associated with each of these careers. And I decided that I'd go read about clinical chemistry as a career because that's what popped up first, and the American Association for Clinical Chemistry. I had never heard of this as a career before. And so you can guess based on where I'm a fellow and in what that I really liked what I read. And I discovered, even after taking an entire semester-long course at my graduate school that was entitled Non-Traditional Careers for PhDs, that I really liked what I found. And so today I want to talk to you about clinical careers for PhDs. So I want to start with clinical chemistry because that's what I know the most about. Specifically, what my experience has been at Mayo Clinic, and then some of the other training programs available, and some of the differences between the training programs, what a day looks like as a clinical chemistry fellow, what are the career prospects for clinical chemists, and then what other clinical fellowships are available. If chemistry sounds awful to you, do not despair. There are other clinical options for you. So what is clinical chemistry? I don't even know. I had no idea what this was when I started. And what is it like training at Mayo Clinic? How do these training programs vary? So what is clinical chemistry? So by definition, clinical chemistry is the study of bodily fluids for therapeutic and diagnostic purposes. So it's basically applying everything that you've learned in your biomedical PhD to patients in the hospital on an outpatient basis, trying to help diagnose a disease, monitor a disease, and I was absolutely shocked that this could be a career for me. And I don't mean at the bench. There are separate bachelor's level and master's level degrees for clinical lab scientists. And I work with these incredible folks every day and would not have learned half of what I've learned as a fellow without them. I'm talking about being a laboratory director. And this is actually one of our laboratory directors right here, Dr. Paul Janetto. He's the director of our toxicology and metals laboratories at Mayo Clinic. And these are just some images I found from a web search of clinical chemistry. And because I interviewed for fellowships during the pandemic, I had never been in a clinical lab before. And so I had to virtually tour a clinical lab. And it's not the same as touring one in person, I assure you, but I've provided a link here, which we won't watch for time's sake because it's about an 8-minute video, but this is an insight into a clinical chemistry lab from the UK. It's an excellent video, just showing you the workflow of a clinical lab and all of the responsibilities that a lab director has oversight of. And so continuing on into what this looks like, just as an example, at Mayo Clinic laboratories, we provide over 3,500 different tests in our lab test catalog to both our internal clients, so all of the doctors that work at Mayo Clinic, and our external clients. So Mayo Clinic is also a reference laboratory to patients all over the world. And about 1,600 of those are lab developed tests, meaning that they're not FDA approved. They're tests that we've developed and validated in-house. And this, when you're getting your PhD, I know I felt like I was an expert in a very, 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 very small area. I was the subject matter expert in this one protein, in this one setting. And I worked in the emergency department for a decade before grad school, during grad school, and I missed kind of being that jack of all trades. And clinical chemistry provided me that opportunity to get back to my roots of being a jack of all trades. 3,500 lab tests is a lot of lab tests to be familiar with. And during the fellowship, it's a 2-year fellowship, and I'll go over kind of the structure of that. But during that time, you become an expert in multiple analytes, basically anything you can measure in a patient specimen. If there's a lab test for it, or there's a need for a lab test for it, you will learn about it. The pathophysiology of human disease. So it's mini med school in a year. All of the different methods that you use in a clinical lab, the software, the hardware, all of the instrumentation. So we do ELISAs, we do gels, Western blots, we do immunofixation, we do oligoclonal banding, so isoelectric focusing, mass spec like nobody's business, gas chromatography, liquid chromatography, you name it, we do it in the lab. And the people that you get to work with. So you're not just working with laboratory staff, but also physicians, patients, administration, all of your test development staff, your quality specialists in the lab, and also clients, outside clients, depending on what kind of lab you work in. So it's a lot more diverse than just a research setting or just a clinical setting. The good thing about clinical chemistry is you do get to interface with all these different folks on a daily basis. And these are just some of the professional societies that support clinical chemistry that we attend the meetings of every year. I presented research at 1, 2, 3, 4 of these societies meetings in the last year. And it's a really, close-knit but diverse group of folks, and everyone is fairly humble and nice, and something that I didn't find in academia. So let's go on and kind of talk about so the one thing that draws all of this together that you get in your PhD is this ability to critically think. So my PhD is in molecular physiology and genetics. My co-fellow, his PhD is in biostatistics. So we have very different backgrounds. I have a very clinical background. He has a very mathematical background. We're learning the same material in this fellowship, but it's both of our abilities to critically think and analyze situations and patients and information that we're given that makes us both very successful fellows. We have very different skill sets, so we pick up different projects. And so it's a career for anyone that's interested in it. You don't necessarily need a certain background to get into it. So what does the structure of a clinical chemistry fellowship look like? So it's very different from your traditional postdoctoral fellowship, a research fellowship. So the first year of the 2 is rotating through all of the different labs that whatever institution you attend has. So at Mayo Clinic, there are 16 different labs. You spend the most time in kind of the core lab and the hospital lab. So these labs do the most tests by volume. So all of your main chemistry tests, your metabolic tests, your lipid tests, any test that you get at your annual physical, all of those tests are done in these labs. You also spend about a month in the protein antibody immunology lab and the mass spectrometry labs. These also do huge tests by volume at Mayo Clinic. And then you spend about 2 to 3 weeks each in the specialty laboratories. Again, depending on where you would do a fellowship, not every institution has all of these specialty labs. A lot of these are unique to Mayo Clinic, but our clinical immunoassay lab is dedicated to immunoassays as the method. So they measure all sorts of things like tumor biomarkers. The toxicology lab measures drugs of abuse and other poisons. The renal lab measures markers of renal function. The cardiac lab, the name implies. The special chemistry lab measures a lot of analytes in body fluids other than blood and urine. The laboratory genetics and genomics lab, we'll talk a little bit about that more at the end, but that's actually a completely separate clinical fellowship that you can do. It's very high in demand right now. I think I found about 35 different fellowships for that specifically. We have a cell and molecular immunology lab that uses flow cytometry as the main methodology in that lab, and they look at a lot of primary inborn immunodeficiencies. The neuroimmunology lab is a very unique lab to Mayo Clinic, looking at neuroautoimmune diseases. Our metals laboratory uses inductively coupled plasma mass spectrometry to look at metals. The biochemical genetics lab is another separate specialty that you can go into as a clinical fellowship. Our advanced core lab rotation is actually going back to these first two labs, but instead of doing it as a rotation, you're serving as the lab director for a month. So completely different view on all of the basics that you learned during your first month. Our special coagulation lab is a really cool rotation, learning about all of the different factors in the coagulation process. And then metabolic hematology is a rotation where you learn about all of the different hemoglobin variants and also thalassemias, but using a lot of techniques that you've probably used during your PhD. So a lot of Western blotting, capillary electrophoresis, HPLC. So techniques that we're all very familiar with using in the research lab, but applied clinically. Just throughout the year, during your first year, every month or so, you get a research week to work on projects that you've picked up or catch up on work that you need to do. You do have projects available to you on most rotations. I would argue that at any stage in your academic career is a good time to learn balance and how to say no. It's not something I'm very good at, but I'm learning. And then one thing that is that Mayo Clinic offers is a leadership and management course that you take throughout your first year that teaches you how to become a lab director, not just how to be a clinical chemist, but how to be a leader and all of the financial aspects of a lab and legal aspects of a lab and things like that, which are important, things I did not know. And then another thing that is really important is being on call and how to actually handle clinical requests. So Mayo Clinic still uses pagers, probably because there are thousands of trainees and they cannot give everyone an iPhone. So what does the on-call experience look like? And this is not unique to chemistry. This is any clinical fellowship that you do has an on-call component where you take clinical calls from physicians where Now, I will say that a lot of these call types are probably unique to chemistry, but you can imagine for some of the other clinical specialties that I'll mention what the calls may be like. But for chemistry, we get a lot of calls about specimen integrity and how that may affect the results. So I'll give you an example. If you think back to your basic cell biology, the concentration of potassium is really high inside of cells, and outside of cells, it's really low. And so if you have a serum specimen from a patient and it is hemolyzed, meaning there is a lot of excess hemoglobin in the specimen, that means that the red blood cells in that specimen have lysed open for some reason, and the potassium in that specimen may be falsely elevated because the potassium inside those red blood cells has now spilled out into the serum. And so one thing that we have to do is figure out clinically if the potassium in that specimen matches the patient's clinical condition, or if maybe that specimen is not of proper integrity and we need to redraw it. So that's a call that we get very frequently. And so understanding the cell biology of that situation, coupled with all of the pathophysiologic conditions that may cause elevated potassium in a patient, is our role as the fellow on call. We also deal with some critical lab values, so a critically elevated or a critically low lab value. Sometimes the lab can't get a hold of the patient's provider, so we just serve as an extra layer of phone tree in that case. Erratic results, so results that are not compatible with life, might be a contamination or an interference of some kind with the assay. Some drugs interfere horribly with certain assays. Biotin is a good example of a supplement that patients started taking about 10 years ago, but is also a reagent that is used in a lot of assays. So trying to sort these things out can have clinical consequences on patients. How to interpret test results. We get a lot of calls on toxicology testing. My patient is only prescribed oxycodone, but they tested positive for morphine. Is this a metabolite of oxycodone, or are they taking something else? Another one is tumor markers. My patient had breast cancer resected 10 years ago, but this tumor marker has started trending up. What does this mean? And then we get a lot of miscellaneous calls. These are always my favorite. And they could be anything. You never know what you're going to get. And this is one of the most valuable aspects of any fellowship, are the types of calls, because you fly through your first year so quickly in any of these clinical fellowships that it's really, really hard to retain all of the information that you get about all of the different kinds of testing available. But when you're on call, you really dig deep into every single test that you get a call about. And that's when you remember the most information about all of those tests and the pathophysiology that contributes to the need for that kind of testing, or the interferences that can contribute to some of the issues with tests. So just some of the examples of topics that we cover during our first month of fellowship. So like I said, it's mini med school during the first year. So quality of lab tests. You want all of your results that you give to patients to be accurate. And the way to make sure that happens is to have a good quality plan in place. As I mentioned, hemolysis, lysing of red blood cells, and what impact that has on each analyte. How do we evaluate new methods in the lab, both analytically and clinically? If you have a new test, it's great, but how does it contribute clinically to a patient's diagnosis? Body fluids other than blood and urine, pericardial fluid, peritoneal fluid, pleural fluid from the lungs. They may have analytes in them that are of clinical importance. Hematology testing, so white blood cell count, red blood cell count. We do all of that in the clinical lab as well. Electrolytes, sodium, potassium, chloride, very, very important. Introduction to endocrinology. This is, a whole 6 months in med school and you get it in a week. Automation and what to do when it fails, because inevitably it will fail and you need a backup plan. Pregnancy and all of the other body systems that can be affected by pregnancy. Calcium, phosphorus, parathyroid hormone, bone-related analytes, immunoassays. Again, we use ELISAs and other types of immunoassays in the clinical lab that aren't on a plate, but maybe in suspension. That's a huge methodology in the clinical lab. That's why PhDs have a huge advantage learning about these assays, as we have troubleshot immunoassays. Introduction to renal. Again, a bear of a topic. Coagulation testing. Liver, pancreas, diabetes, blood gas, so metabolic and respiratory alkalosis, acidosis. If anyone's having a little PTSD from that, you are not alone. Point of care, so testing at the bedside, that is under a clinical chemist purview. And then CLIA, so all of the rules and regulations that govern the clinical lab. What are some of the projects that you may take on? These are just some examples of the ones that I have going right now. So I'm using some retrospective data to try and verify reference intervals for transgender patients on stable hormone therapy. Using mass spec to characterize immunoglobulin heavy chain disease in a local patient cohort here in Rochester, Minnesota. I am looking at body fluid analytical measuring ranges for different analytes and how suitable serum quality control materials are for that. I have several quality projects going on, using a machine learning algorithm to predict the presence of an aberrant lipoprotein with standard lipid panel parameters. Not every lab is the Mayo Clinic and has all of this specialized lab developed testing. So how can we use this huge data set that we have to help hospital labs not need such testing? Wilson's disease, which is a copper storage disease, genetic disease. I have a project and a case report going on, and several more. As I mentioned, learning how to say no is a very, very important part of training now. And if you don't learn it now, you will learn it eventually, hopefully. The second year of most of these clinical fellowships, definitely clinical chemistry, is becoming the acting lab director of a lab of your choice. So I fell in love with protein immunology. So I am the acting lab director in the protein immunology lab. So I go to all of the leadership meetings. I am involved in assay development. So we have about 10 tests that are in development right now. I help write all of the IRB protocols for new tests. We just went through our annual development goals. So you sit down and kind of go over what tests are the most important, both clinically and financially. So as a reference laboratory at Mayo, we have a business aspect to us as well as the nonprofit hospital side. It gets a little complicated, but we also have kind of those financial business meetings with the business side of the lab, where they outline which tests make the most revenue, and depending on what area of the industry you work in, we'll go over that in the career section, but this may be a much larger part of your day-to-day than it is if you're on the academic or hospital side. We do a lot of lot-to-lot comparisons for reagents for those assays. When you get a new lot of reagents in, you have to make sure that they're behaving appropriately compared to the lot that you're running right now. difficult clinical cases. So a patient may have a strange presentation and their lab tests don't match. And a lot of times it's an interference of some kind that is unique to that patient. So you have to help troubleshoot and figure out another way to monitor that patient's disease. And also, in your second year, you tend to pick up new projects that are specific to that lab that you've chosen, as well as finish up any hangover projects from the first year. You also support those first year fellows. So you were a first year fellow who had second year supporting you, and then you get to move up your second year to be the senior fellows, as well as your clinical duties. So you still cover the pager and have those on-call responsibilities. So I've mentioned kind of my experiences at Mayo, but there are other training programs than just Mayo. And so the COMAC is our accrediting organization for our training programs. And I have a resources slide with all of these links, but there's 34 training programs, and there's variability in how these training programs are structured. So most of them are at large academic medical centers. There are a few exceptions that are at just like health systems. For example, here in Minnesota, up in Minneapolis, there is a clinical chemistry fellowship at Hennepin County Medical Center. It is not a small medical center. It is a very large medical center, but it isn't affiliated with a university, for example. Most training programs only have one fellow per year or biannually, depending on their funding. The two exceptions that I'm aware of are Mayo Clinic and ARUP laboratories at the University of Utah in Salt Lake City. There's a lot of variation in how the programs structure their kind of classroom learning or didactic sessions. So all of those kind of learning topics, the mini med school that I mentioned, learning all of that, the rotations through the laboratories, board prep time. So the end goal of most fellowships is to have a board certified clinical chemist at the end. There are 2 board exams that we can take, the American Board of Clinical Chemistry or the National Registry of Clinical Chemistry board exams. ABCC, I think, is the preferred board exam because it is the one that you need in order to be a program director of one of these programs. But either, I think, is sufficient for a job. The expectations of you as a fellow vary by program. Your responsibilities, your research, your publication expectations. For example, at Mayo, we have 16 different laboratories. We're a huge reference lab. And for that reason, one of my responsibilities doesn't include trying to evaluate which tests I need to send out to another lab, because we don't send tests out to other labs. They all stay at Mayo. But at a smaller hospital, for example, a huge responsibility of their fellows is to evaluate which send out tests are reasonable requests. And so those responsibilities vary depending on where you're training. And then some fellowship programs actually want their fellows to have a unique skill set. So for example, some programs want their fellows to be really skilled in mass spec or flow cytometry or PCR or something like that, because they want the fellows to come in and work on a very specific research project. And these are things that you find out when you reach out to the program directors with your application materials. So these are things that are found on each of the program's websites, which can be found through this main COMAC website, again, in the resources slide. So let's do, yeah, we'll keep going and do questions at the end, I think. So what does a day look like? Typical day. So during rotations, in that first year, we have an 8 to 5 work day. It's kind of flexible, especially since the pandemic. We can work from home 1 day a week. As you can see behind me, I'm doing that today. So you tend to get to work around 8 and your lectures begin. Sometimes, depending on your rotation, you may have like a wet lab in the lab where you're on the instruments learning how to do experiments, or learning how to operate them. We look at urine samples under the microscopes, which is actually a lot more fun than it sounds. Doing things on the mass spec. So depending on the lab, you may be in the lab. You do get a lunch hour almost every day. Sometimes you may have a seminar, but they're via Zoom these days. You have more kind of didactic sessions in the afternoon, but there's normally at least a couple hours broken up throughout the day where there is time to study. Throughout the week, you have conferences and seminars that are relevant to what you're doing, which is really awesome. You do have a clinical pathology seminar every week, again, relevant to what you're doing. Every week, the person that has had the pager all week presents their most interesting calls to the faculty, where it's just a really informal bouncing around of ideas and hey, I had trouble with this call. Would you have done it differently? It's a really awesome learning opportunity. And you get a lot of publishable cases at Mayo because you see some really unique patients. And then you do have some monthly seminars as well. And then about halfway through your first year, the pager comes to you and you get it about once a month or so for a week. And pages can happen at any time throughout the day, and you answer them and handle whatever requests the person needs. So the second year, you know, I might get to work a little earlier or start working from home a little earlier, but instead of didactics, you have meetings or data review with maybe some of your assay developers or some of your technical specialists. One thing that my lab does is sign outs, where we look at some of those Western blot gels or immunofixations and interpret them and release those results to the patients. And so that's one of the things I really enjoy about my lab. Genetics does a lot of that as well, as does microbiology. So we'll talk about that a little bit at the end. So the days look a little different. You do have more free time that you can fill with writing, research, data crunching. I will say a little plug for learning R. If you're interested in clinical, doing something clinical with your PhD, knowing R is a big asset. I did not know it. I'm learning it. It's not as painful as it sounds. There's a lot of online resources, but it's a good thing to know. A lot of the same weekly meetings, monthly meetings. And then again, you keep being on call your second year. The burden's a little bit lighter the second half of your second year because your new first year fellows have the pager, and you answer those pages as they come. And this is just a screenshot of my calendar. I think this was last week. So, you know, I have some free spaces in there that I have an hour to do some research, crunch some data. So I'll say that I never dread waking up. I never dread going into the lab. I really, really enjoy what I'm doing. So, and I'm excited for the job hunt that I've started. So that brings me to kind of the third little chunk of this is what can you do as a clinical chemist? What does that look like? And what does the job market look like? So the types of careers that you can have as a clinical chemist are at an academic medical center. So your standard, academic medical center, a hospital or health system, kind of a private practice or lab, industry. So your Quest, your LabCorp. This is a big area for clinical chemists. Private consulting, and then working at a reference lab. So around August, September of your second year is when you start looking for a job. So I have started. And this is a screenshot from pathologyoutlines.com. It's a website that lists a lot of our jobs. And this is just by number of jobs for clinical pathology, which is our area. And before the pandemic, it started to grow, but it has stayed very high since the pandemic. There's been a realization that lab medicine is important. There's several places to look for jobs, professional societies, American Association for Clinical Chemistry, College of American Pathologists. But I will say that I've had the most luck and the most leads just through my network. So another plug for, even though it's painful, networking, going to conferences, talking to people, it's such an important part of growing your career. So one thing that our professional society has done is sent out a survey to this kind of all of the board certified clinical chemists working in the US, and they got 113 responses, and they published a paper with all of the salary information for these clinical chemists, which is amazing. It's really hard to get salary information. So I'm very grateful for this as someone who is getting ready to negotiate my first job. But by years of experience, you can see that, they've broken this down by quantile. So, here's going to be me, and here's the median salary for board certified clinical chemists. They also broke it down by geographic region. I don't know why most clinical chemists live in the Midwest, but they do. And then by employment sector. So again, most clinical chemists work in academia, median salary 180 to 189,000. Unsurprisingly, most the highest salary is in industry, but also has the fewest folks working in industry. So just good salary breakdown information. And then the last bit that I wanted to talk about that I'm, again, a little less familiar with just because of what I've chosen to do, other clinical fellowships, if chemistry is not your cup of tea. So it's not as big at the moment, but that is going to change soon. There's this bucket for immunology and or HLA or transplant. Laboratory genetics genomics, which I mentioned is massive. Biochemical genetics, not quite as big, and then microbiology. So in the notes section for this slide, which let me get out of here real quick and show you how large it is. I have listed all of the program websites for lab genetics genomics and clinical biochemical genetics. So I will send these slides, but that's how many programs there are for LGG and biochemical genetics. But just some of the areas that are covered by these clinical specialties. And again, these are open for PhDs. There's also medical genetics and medical biochemical genetics. Those are the MD flavor. So the clinical genetics, clinical biochemical genetics are the PhD flavor. So clinical immunology, this is the one where there aren't as many fellowships at the moment because the board exam went away about 5 years ago, but that is being reconciled right now. So your infectious disease serology, your allergy autoimmune, flow cytometry, cellular immunology. Let me get my pointer. Oops, sorry about that. Let me get my laser pointer back. Sometimes your HLA or transplant immunology can fall under clinical immunology, but there are a few separate fellowships for just transplant immunology. And then immunoglobulin analysis. So all of those antibodies. So there's clinical immunology. There's 2 fellowships for this that are still active, one at UNC Chapel Hill and one at the University of Utah or ARUP labs. I know both of these program directors, they're excellent. Transplant immunology or human leukocyte antigen immunotyping. I'm a transplant nerd. So I love this and am not training anymore because if I train again, I will be divorced. But I want to continue to further my knowledge in HLA through kind of on the job training because transplant is where my heart is. And there's 3 fellowships in the US and 2 in Canada in HLA, where you focus on immunotyping for both solid organ and bone marrow. And this is a bear, but I love it. Lab genetics and genomics. So this is a super cool area that includes pharmacogenomics too. So genetic polymorphisms that impact how you deal with pharmacologics. So really, really niche area of medicine right now, but clinical and molecular genetics. So your cytogenetics, sometimes biochemical genetics is in here, but there is a separate area for biochemical genetics if you want to subspecialize. But this covers both your kind of hereditary genetic conditions as well as cancers. So these clinicians analyze, so they develop new assays, first of all, but they also analyze results. So big informatics area, if you're interested in biostats and informatics and machine learning, but they also kind of analyze these genome sequences and figure out what mutations folks have in what areas and help diagnose these diseases. So it's a really cool area. You do rotate through this lab in the Mayo Fellowship, and then in the chemistry fellowship at Mayo, and then biochemical genetics, you also rotate here in chemistry at Mayo, but inborn errors of metabolism. So disorders of carbohydrate, glycogen, metabolism storage, newborn screening follow-up. So if anyone's had a baby, they do the heel prick and spots on the card. If there's anything that flags on that, it goes to this lab for confirmation. And those disorders are monitored and followed up by biochemical genetics. And again, there's links to these programs in the comment section of this slide. Again, just some more resources. So the professional organizations, a separate plug for females in mass spec. Woohoo! But here's that COMAC clinical chemistry training programs. There's links to all of the training programs. I didn't go much into microbiology because I'm not super familiar, but what I do know is in order to apply for a fellowship in clinical microbiology, they have a portal that you apply to individual programs through the portal. And I did put some of the individual programs here in the comments. But we interact with their fellows quite a bit and they're incredible. So they seem to really enjoy what they're doing as well. But and I, you know, I want to give a plug for exploring career options, because I had no idea that I could do something so cool and so clinical with a basic science PhD. And there are so many options for careers out there. And if you keep looking and keep coming to seminars and talking to people and meeting people, you'll find something that sets your heart on fire like I did. And here is my email. Feel free to email me or connect with me on LinkedIn. And I'm happy to answer any questions. Thank you so much for having me.
Excellent. Oh my gosh, thank you so much. That was amazing. I had no idea how transferable. It is amazing how transferable skills can be, and
Yes.
jobs that you can, I love that. I love that. I'm so happy for
Yeah,
you.
I was shocked.
The audience, you've been quiet. Feel free to unmute yourself if you feel comfortable, or use the chat, or if no one feels comfortable. Rye did share her contact information to reach out at another time, but we'll see if anyone has anything they would like to ask or comment. If not, that's okay. Sometimes you
Yeah,
have
no
to
worries.
process.
It's a lot.
Mhm.
It is a lot of info, but yeah, I'll send these slides to you. I
Great.
don't know if you have a way to get them to folks, or
Yeah, I do. Yep.
but
No problem.
yeah, I scoured the internet to make sure that I could get all the links. So
That is awesome. I love that. Sharing
yeah,
resources.
Patricia, it's a lot to digest. I'm still digesting, and I'm a year plus in, so I feel that.
Oh, the survey in the beginning of your talk, someone did ask, is there a link for that if somebody was interested in using that tool?
Oh, my science IDP. Yeah, it's I put the link at the bottom of the yeah, the link's at the bottom of that slide. That
Okay.
is the link for it. And I'm pretty sure it's free. I just like created an account and did it. I don't think I had to be affiliated with my school or anything to do it. So and I was able to log back in like yesterday and take
Oh,
this screenshot. So but yeah, that was the link at the bottom.
okay,
So
great. There is a question. Oh,
yeah.
go for it.
Katie
Mhm.
asked, can you elaborate on how work-life balance is during the training program? Yes. So I think it's better than during my PhD, if I'm being honest. But so the caveat to that is I don't have any kids, and I have a spouse that works more than I do. So work-life balance for me is coming home and laying on the couch with my cats and watching TV. So I have time to do that. I think it depends on where you train, but Mayo specifically has a really good philosophy on work-life balance. And what I've heard from my friends that have done traditional postdocs, this has a much better work-life balance. It's a 8 to 5, 9 to 5. You go to work, you do your stuff, you come home, you do your life. You don't have to work after hours or on weekends. We have faculty members that do not check email after hours. The exception to that is when you're on call. So when you have the pager, you are on call for 7 days in a row, 24 hours for 7 days. It can be a long 7 days, but they have put some things in place to reduce the amount of calls you get at night, which is golden. So most weeks I go the whole week without getting woken up by a call. So it's just like during when I'm awake anyways. So, but yeah.
Wonderful. Well, thank you again so much for reaching out and
Yeah.
for coming and giving this great presentation. And we look forward to disseminating this information to you all. And I hope it's sort of giving you some food for thought of some alternative things you can do with your skills and what what's available to you.
Yeah. Thanks so much for letting me talk about it. I'll scream to the rooftops. Let people know about it. All right.
Well,
Thank you all
everyone,
so much.
yes, have a good rest of your day.
Y'all too. Take care.
Bye.
Bye.